Good morning,
Hi.
President Adler. We're ready whenever you are.
All right, I guess we'd like to call this meeting to order. We have a motion to get going.
So moved.
Second.
Second.
All righty.
All right, introductions. Today, I'm just a quick logistics about how we're doing the meeting today. In previous board meetings, the last couple board meetings, the board was considering live streaming board meetings to the public who cannot be in the building for one reason or another, so we can get more engagement and be more transparent. The board tasked myself and staff to look into options on how we can do that cost effectively. So we looked a little hard, and we found out that our original boardroom, when we were designing this building, there was no COVID, and who knew back then that we were going to have COVID in 2020. So the board where the board is meeting today is the original boardroom, and that's why back then was wired and equipped with the video conferencing equipment with that respect. Now, after COVID, we moved to the bigger room, and that's when we hit some challenges on how sound is going to be okay and video is going to be okay if we are to do something like that to the public, in the COVID times. So moving forward, we are just trying here to see how today's meeting is going to go. And we'll adjust accordingly once we get the IT feedback and some of the public feedback on how was sound, how was the picture, so on and so forth. So what today is a trial. We have the public in the big room now, and we're broadcasting from the existing boardroom because we have the equipment to the public. So it will be transparent for the people who showed up in our building as well. With that said, I'm going to turn it to Cheryl to introduce your guests. Who do you have in the other room, Cheryl?
Good morning. Can you hear me okay?
Yes.
Okay. Good morning. This is Cheryl Miller, Communications Specialist at Hancock Public Health. And with me, I have Casey Berquist and Angela Guthrie.
Very good. Thank you, Cheryl, and welcome to our guests. We'll go ahead and start with our board action.
All right. 2.0.1, we need to have a motion to approve today's agenda items.
So moved.
Second.
All righty. And do we have any talk about the meeting minutes from our March 18th? Or any adjustments or anything needed?
The only thing I noticed in reading the minutes is I think on page 4, I think the word is supposed to be addiction and it says addition.
All right, page 4. Let's get to page 4 here and make that correction.
Which paragraph?
I think. I did not bring my paper with me, marker. If you go, I might be.
Here.
Oh, we're still on page 3.
Oh,
I'm sorry.
it's paragraph 3. It says Mr. Algie asked what information
Oh, yeah.
Okay.
experiencing addition. It should be
Yeah.
addiction, correct?
Yeah. Good catch.
Noted. Any other changes, additions?
Discussion. Do we have a motion to approve the meetings with the adjustment?
So moved.
Second.
Second, all righty. And we need to go over the March 2022 bill schedule.
Want to make sure we pay our bills. So we would like the board blessing on that. Those are our usual monthly bills, the car leases and vaccine, travel. And now we're a little beyond the effects of COVID. We start allowing our staff to travel. So you're gonna see that that line item is being used more and more. I think it's important to reconnect with their peers at the state level and even at the national level. During Chad's report, he's gonna talk about their travel to Atlanta to attend the preparedness summit, and that was really valuable. So again, those are our usual bills. If that was attached to the packet as well. If you have any questions about any of the bills, I'll be more than happy to explain.
With respect to the grant expenses, could you explain that?
Those are the different grants that we have, and that's where the money came from. It didn't come from the general fund. A quick example, I will give you the Brown Supply. That was janitorial supplies like paper towels and soap for the mobile health clinic. So that came out of that project. So on and so forth. Some for the GVO, where our immunization grant, like the Friends filing cabinet and bookshelves, those came out of the injury prevention grant. So we separate those as we pay our bills because they have to come out of that specific line item that's connected to the grant.
On the mileage reimbursement that you have.
Okay.
What rate do you guys reimburse that, do you know?
55 cents.
55 cents. We go with the state per diem, and I think it went up to 55 a couple weeks ago. Yeah, from 52.
All right.
Again, mileage reimbursement is for staff who don't have an assigned car because they travel occasionally. It's not part of their job to travel, but if they are to travel on business, we'll have them do reimbursement. And speaking of that line item, since you asked, every year or two, because the last couple of years were not normal, we couldn't get a good baseline. We do kind of a mileage study. We've done that back when we combined. And I think we decided that it will cost us less to lease cars than pay mileage, especially for our inspectors, for our home visitors who are going out. That's part of their job. It's their field job. So, but again, occasionally, if clinical staff or health education staff or any other staff who cannot find a leased car available for them to travel on business, we will reimburse mileage at 55 cents.
Okay, so you guys do a study every 2 or 3 years on?
Right, to see what's more cost effective for the board. Is it lease cars or pay mileage?
This is a cross-category comment, I guess, but I have 35 company cars now, and we're 2 million miles into the company cars, and we're running the whole fleet for about 34 cents a mile. And that's mostly new cars. Some are bigger than what you have. So you're probably way under, from my experience, saving 10 or 15 or 20 cents per mile doing the lease that you're doing.
Sure, and the leases have been pretty good for us. And one consideration is the cost. Another consideration is safety. A lot of, especially in the Help Me Grow program, a lot of the home visitors, they will go after hours, and sometimes it gets dark early in the winter time to do the visits and make sure they're helping the families. Sometimes it's not the best areas they go to. There's the factor of using their cars for sanitation purposes as well too. So like in the environmental, I can give the example of our sewage inspectors. They carry a lot of equipment with them. Those boots are full of mud and everything else. And they go into the county, into the country where probably the roads aren't the best. So we would, providing a car, I guess will work best. And they do long distances too. So it's more cost effective as well as safety.
All right, any other comments about the bill schedule? Nothing. Do we have a motion to approve the bill schedule for March 2022?
So move.
Second.
All right. All right, and now we're asking the board to approve a decrease in the following revenue for fiscal year ending 12/31/2022. And it's a safe sleep project in the amount of $32.50. Do you need to comment on?
Yes, quick comment. This line item was tabled last board meeting because I did not have the exact amount. As we are moving money and board approving us moving appropriations, decreasing or increasing or recognizing revenues, the right amount has to be reflected in the agenda and in the minutes. So for auditing purposes, and we've been audited a few times this year, and we expect that to happen a lot now that, after the COVID money. So we would like to bring that to the table this month for the board to approve that a decrease in the following revenue for fiscal year ending 12/31/2022. That's a safe sleep project in the amount of $3,250 even.
Okay, do we have a motion to approve?
So moved.
Second.
Second. Any other comments? Board of Health to approve nurse practitioner position, description and salary scale.
Yes, and I did include that in, I made copies. This is, as we are getting ready for the season to get the mobile health clinic going, and that's part of our strategic plan and part of our deployment plan to get it going. We want to make sure it's fully staffed to go. I think original plan was for that clinic to be staffed with the nurse practitioner and a nurse helping that person. The practitioner will be the coordinator of all activities of that mobile. She or he will be responsible for the schedules. They will be responsible for networking, and they will be responsible for the whole operation. Of course, with the support of the team here, myself, Shannon, Alexa, and the rest of the leadership as well. But that's the intention. That's a new position we have here at Hancock Public Health. Within their scope of practice, that position will be for medical, and within their scope of practice will be reporting to Dr. Ratnan Sami, our medical director. For administrative stuff and support, they will be reporting to me, and Shannon will be helping you with that for the clinical staff to help that person as well. So we did a lot of research, and the reason it took so long is kind of trying to figure out the pay scale and the pay range. Again, not having that position before, I think we've done a lot of research, and again, Shannon helped me reach out a little bit, and we'll get some feedback from around the table, doctors, lawyers, and nurses as well. So you guys might have an idea what's the ongoing rate right now. Of course, in a public setting like ours, that person is going to be paid a little less, but with the understanding that they will get the benefit of a set schedule and stuff like that. And it might be appealing to some individuals out there on the hope that we can get that position filled. So again, a little research. The hourly salary ranged between 50 and 63 for individuals with 5 or more, 6 or more years of experience. We're not, if you read through that, we're not asking for 5 years of experience, but we're looking for at least 1 year of experience, and probably we'll start them a little over 50 on that base. So what I'm asking the board today is to approve the addition of that position to our pay scale, and the pay scale we came up with after discussions and feedback.
When you say experience as a nurse or experience as a nurse practitioner?
We're looking for experience as a nurse practitioner in a family practice type, primary care, women's health, peds, stuff like that. And I think that's kind of detailed a little bit in our description. Okay. So I think the plan is to go ahead and post this position once we get the board approval on Monday. We already, when this whole mobile health clinic details were out in the news, I've had a couple people reach out inquiring about the position. So once we post it and we start getting in, candidates for it, with the coordination with Dr. Ratnaswamy's schedule, we're gonna schedule some interviews as we go. Per our policy, that position have to be posted for 2 weeks, and we'll keep it posted and open for 2 weeks. But that will not preclude us from interviewing in the meantime as applicants are applying for that position. So that's the plan for this hiring.
And it's a full-time rather than a part-time?
It's a full-time, but it's 35 hours. So in looking at the budget and being like a higher paid, staff, we want to kind of try to work with the budget. So I'm looking into contracting with that individuals for 35 hours a week, but we'll see how things are going to go and we'll reassess. We'll come back and reassess. But I think the budget and the expectation of our partners on that project is to have full-time 35. Now, again, part of working on that initiative, me and Shannon had long discussions about how we want to go about the schedules. I'm sure they're going to be real busy now in the spring, summer, and fall. How do we transition some of those activities into some other ideas we've had discussed with Dr. Ratnaswamy earlier when we combined on how we can maybe start at an STI clinics or something like that once a week for that crew to be involved in that as well. So I think in all, it will be good addition and an asset to our staff. Having that person, and I think it will, under the direction and guidance of Dr. Ratnaswamy, probably will expand on some of the services we already have.
Would the employee would the person be an employee and on the staff?
That is correct, but they will be contracted and exempt, just like my contract. And this way, I think we'll be able to, and that will be the expectations that we will lay out on the table while we interview that individual. That now we have funding for that mobile clinic for 3 years. Beyond that, we're gonna try to diversify and keep them on staff for longer. But just in case funding dries up or we can, there's no more provisions for that position, we'll be able to terminate the contract.
Any other discussion, questions? All right. Do we have a motion to approve 2.0.5? Nurse practitioner position description.
So moved.
And a second?
Second.
All in favor?
Aye.
Any opposed? All right, 3.0, we're at staff reports.
And we will start with Dr. Ratnaswamy's report here. Let me just set it up real quick.
Okay, good morning. So as we've gone back into more quote-unquote normal times, I just wanted to touch on one of the common problems that I see, and even in my practice of infections, obesity ties into that. And a lot of people that I take care of have obesity as an issue, and how that contributes to infections is on the slide. A little bit of busyness there, but there's respiratory tract considerations, skin and soft tissue. There's changes in the microcirculation. There's lymphedema. There's decreased wound healing, and even immune system components in people with obesity. There's impairments, and then obesity also is associated with diabetes and hypertension and atherosclerosis or hardening of the arteries. So those all tie in, and so it's like, okay, I need to think upstream as well. So rather than just take care of infections downstream, just looking at issues upstream. So okay. So what is obesity? The classic definition is a body mass index of over 30, and that's weight divided by height squared. And there's calculators all over the place. You can get that. And it's a fairly simple calculation, but it's not a perfect calculation. And people are muscular like me, you may have high BMI and not be obese. So an older person may have a low BMI because their muscle mass is down, but they can still have problem with visceral fat. And so the visceral fat is what we're more concerned about. And so sometimes we'll see research studies looking at doing CAT scans or ultrasounds to actually measure the fat in around organs and so on. A simple measure could be also measuring waistline and hip, or comparing waistline to height as another indicator for visceral fat. So these are the classifications. When body mass gets over 25, a person's considered overweight. And when it gets over 30 or over, it's considered obese. So this is from a website called Our World of Data. About 4.7 million deaths have connections to obesity worldwide, and premature deaths, I should say. And then about total deaths, 8% attributable to obesity. And there's differences in different parts of the world. And overall, 13% of adults across the world population are considered to be obese. And 39% of the world population consider overweight. And one of the concerning areas is the increase in children. And this is, ties into a lot of health issues. I have to throw in one COVID slide. And so if you look at share of deaths attributable to obesity by population rates, as this struck by cumulative deaths per million people. Again, just the population rate. And, a little bit of overlap. Where the higher obesity countries also had higher COVID death rates. And this is, borne out in clinical experience. People that got into trouble, a lot of them had obesity, more severe obesity with BMIs over 40. So a lot of obesity deals with caloric intake. And so if you look at the graph on the bottom axis shows caloric intake per day, and the vertical axis shows the percentage of the population obese or overweight. And the United States has average caloric intake over 3,600 calories, and we have 70% of the population that has either obesity or overweight. And but if you look at other countries, there are some countries with less resources that still have issues with weight, and we'll talk about that could be a little bit. So, for example, Venezuela toward the middle there has still a fairly high caloric intake and has 60%, and that's a fairly low resource country. So these are the trends in the United States. So we're up to about 42% of the population having obesity, and there's been a steady increase in that, and severe obesity about 9%, so that's also been climbing. So there's definitely an area of concern for health. And there's variations, as we talked about, variations in the world, even in the country. There's variations from state to state, and the map on the left of darker colors show higher incidence of obesity, and Ohio is in that band. But fortunately, this is from CDC sites, and I should have looked at our chart, but at night last night. I couldn't remember where I put our community assessment. But
It's coming up here. We should
yeah.
run soon.
so it was reported as 32%. So we're less than the national average, and so that's good, and we want to keep that way and working toward improving that number even more. So this was a nice little diagram talking about thinking upstream. You know, by the time the person has obesity and then starts having diabetes and other problems connected to obesity, if we look over behind, upstream, there's the behaviors. So more caloric intake, there's less activity, and you know, obviously genetics plays a role for some people that runs in the family and so on. The concept of obesogenic environments was interesting, and so just look into that a little bit. And again, there's high intake situations, and if you look at what may be factoring into that, there's advertising, there's the convenience of a quick bite to eat, just because we don't have time to sit and eat more healthy food. There's food affordability issues, and this, especially now with inflation going up, there's more of the food insecurity, and so choosing the cheaper food is not always the more healthy food. And so those are all things that we'll, you know, have to keep mind on as we see the changes in our economy and going forward. Then also the sedentary environment. If you look at how's the work environment set up? Is there ability to be more active? Commute. If you look at urban sprawl in the cities, there's higher rates of obesity, and that tends to be, well, you jump in the car to get to anywhere. And whereas if you have a walkable community, which some urban planners are talking about, trying to get neighborhoods with decentralized shopping, so you can walk to the grocery store. So if you think of Findlay downtown, that's popular with a lot of younger people because they can walk to the grocery store right there, walk to work, and so on. And then just encouraging good, healthy lifestyle choices of you know, 30 minutes of physical activity, and you know, a lot of us have started counting steps with various devices and so on, so encouraging all that. So I just talked about what we've been doing, you know, in the health department. We've been in the schools, we've been in grocery stores, we've been in restaurants to help promote healthy menus. And in the community, we've you know, seen Parks and Rec promote increased activity. We've gotten more trails to be able to increase activity. And then just looking at how communities are planned so that we can encourage more physical activity to do regular activity, regular day-to-day things. So it's just a brief intro to be thinking about. You know, we don't want to be always focused on infection, though it is the most important thing, but there are health issues that we need to keep our mind. So I'll leave it at that.
We're finally talking about something else.
You know, although infection does tie in, because obesity is a risk factor for COVID. And there was this, you probably saw this, it was several months ago, where they showed that fat cells actually enhance inflammation, particularly that hyperinflation. So that fits in clinically, because here's somebody that's overweight, gets COVID, they're at risk.
Yep.
Yeah.
Now, what do we do about it, though? Obesity.
Well, I think that's what, you know, I wanted to, you know, we have touched on, you know, we've been in schools, we've encouraged more healthy shopping. We've is it one of the grocery stores that has produce reduced on certain days to make it more affordable. So those are the kinds of things I think we need to get out in the community more. The mayor has done things of promoting walking. Dr. Mills used to have that going as well. So I think, just encouraging those kinds of activities, and having spaces, in some of the larger cities, one of my daughters was down in Atlanta. They have a great, around the city, almost circumference. They took an old railway and a multi-purpose, trail where you just see people walking, and then all around that area, new neighborhoods have popped up and businesses have popped up, and so I'm looking at those type of things.
We are addressing a lot of those in our improvement plan. After each health assessment that we do every 3 years, we sit down with community partners on all levels and kind of talk about how are we going to deal with those priorities that came out of that survey. We're about to do that here soon because our community health assessment, that the survey we've done back in the fall of 2021, it's about to be ready. We're in the final stages and we're designing the cover for that right now. But most of the data has been crunched and we're about to issue the actual report. Once that issued and published as well to the public, we'll reconvene that committee who worked on the questionnaires, who worked on the different part of it, and say how are we gonna deal with those priorities that came out of that survey. It's true, obesity always comes on top at one point, after obesity, and we've noticed the last few cycles we've had that we are moving from one obesity percentage. A lot of those individuals are moving to become diabetic and pre-diabetic. And that's why I think those are one of the biggest priority. Then, chronic illness will follow, heart disease and heart issues and all of that. One of the things we're talking to keep people active, we do team up with the Y, we team up with, with partners here that are nonprofit. We do work with the city of Findlay and the county on, just let me log back in. We do team up with the city and we're working on a comprehensive active transportation plan to tie up all the bike trails, to make some of the streets in Findlay bike friendly. The challenge we have here, it's always the same in this part of the country, is the cold weather. And, a lot of those activities have to be worked out in the summertime or springtime. But some of those challenges, are the winter months that we have here, and how to keep people active and engaged during those times. So now that I'm logged back in there, let me see if I can get back on track. So that's how we deal with it from community standpoint. We have health educators that go and talk about nutrition to schools, like Dr. Atnasami mentioned. So on and so forth. So again, technology here a little bit. So let me try to see how we can go back on track right here. Oh, not this one.
Craig's gonna fix that, so your timeout window
Yes.
is
So.
longer.
Did
All
the
right.
computer crash?
It timed out.
It closed everything out.
It closed everything out, so I have to restart it. Okay, let me start those documents then from here. I'm really sorry, just give me 1 minute here. Okay, I think we're okay, well, that's progress here. So let's try to find. I think we're up to
We're up to
the financial,
7.02,
the financial.
the quarterly financial report.
That's correct. And believe it or not, it is the end of the quarter, so we are gonna talk a little bit in detail about our financial well-being here. And so the board, part of the biggest governance role of the board is fiscal oversight of what we do. So I'm gonna start, we start usually with our let's start with our revenue trends. That's in your packet as well. I printed on the previous sheet I have. So so this is again, we have 3 months under our belt already with this 2022. I can't believe it, but it's happening, and it's going to happen quicker than we would like it to be. Everything is kind of self-explanatory on this chart. Total revenue for March was $847,233.90. It's a little bit higher than previous month because it's usually in the first quarter, whether it's January, February, or March, we receive our appropriation from the city and the county for the operating budget. And we did receive both in March. That's why it's showing a little bit of higher revenue than usual. Total expenses was $278,974.08. As of the end of March, we are sitting on with a cash balance of $1,861,808.36. So as you can see, it would pretty much, and next we'll look at our 7-year comparison. And if we look closer at that on the flip page, it's March is pretty comparable to other on the revenue side, on the left side, comparable to other months we've had in the last 6 years that we've been combined, and this is a 7th. Same on the expense side. So nothing really out of the ordinary in this balance sheet or this Q1 report. So we can take any questions before I go a little deeper. I do a little deeper dive with the which I made a copy as well for our line item sheet. And since it's performance management reporting as well, we did color code those as well. So let me bring it up to everybody to see as well. What we've done here, we color coded, and on the revenue side, it's always, since it's the first quarter, the end of the first quarter, anything we brought in above 25% is good. Anything we brought in less than 25% is okay still, because it's the first quarter. A lot of our programs are seasonal, so we might not see that revenue coming in the first quarter as expected, because some seasons are heavier than others. A good example would be immunization time. Immunization season will be coming up probably in the second or third quarter. Some of the food stuff will be coming in later too, for swimming pools and everything else. So this is just to give you a little visual on how and to give our leadership kind of a little insight of how their programs are doing as far as bringing in revenue. But by no means this is an indicator of any trouble for our budget at this point. Again, a lot of our programs, especially at the combination, I think the marching orders were to move into fee for service as much as we can, and that's why a lot of our revenues are kind of concentrated or focused in certain seasons. So again, this is on the revenue side. Again, green is good, and some of them, like you will see 100% revenues for the whole year, and those are one-time payments, like the city allocations, some of the grants, like the mobile health clinic fund, where we got 100% of what we were expecting to get this year. Again, and all in all, I will look at that line item here that's highlighted on the bottom, which shows that total service revenue for the first quarter is at 29%. And that's the whole number I look at and make sure that we are bringing in more than 25% of the So we're good as far as the revenue side. If you go on the right-hand side, those are the expenses. And now for the expenses, we're gonna flip that color charting, and anything that's below 25%, we're gonna turn green, because again, the whole fiscal responsibility philosophy that we have, we wanna spend less than what we bring in, and make sure we're saving. So anything less than 25 is green. Anything that we spend above 25 is red. Again, just for our internal, as we look at those numbers, we see, okay, what line item is underperforming, or we're expending more or bringing less money, so we can adjust after the first quarter. So same formula here. A lot of our expenses are one time, because we do have not earmarking, but we do have encumbrance, where we say, okay, we're gonna order vaccines for the whole year, but we do 4 POs, like one each quarter, and that the whole amount that set up for that expense will be expended, and you might see some 100% there, or not expended at all because we didn't get billed for it yet, like some of the insurance items, like for hazard insurance or something like that, don't get paid. So it's good for the board to look at those numbers quarterly, but it's good to put the whole picture into perspective and say that this is one quarter of the year, and the nature of our business is not a quarterly business. It's more of a mid-year and a year business more than anything else. I'll be happy to answer any questions you guys might have on that deep dive into our financial well-being. And I think from where we're standing here at the end of the first quarter, we are still in good shape, and we are maximizing our funds to match it with the services we're providing to our citizens. I think as a Board of Health and as staff, we should all be proud of the good job we're doing in that respect.
Do you guys have someone that keeps track of all your contracts, whether it's cell phone or insurance or trash, or
Yes, well, technically that's,
renegotiate those? Because I've been really successful at renegotiating virtually every single contract I have and saving a ton of money.
yeah, and the contracts that got to do with cell phones and IT, usually those are the leading staff on that would be Craig, but our fiscal team will help him, myself, Lindsay, and Chelsea, keep track of those contracts. It's unfortunate, you're right, that we lost our snow plowing contract back in the winter, and we had to negotiate a new contract for snow removal, although we used them only a couple of times, but I think it was timely that we found somebody, especially with the shortage of staff and everything else, and the different companies that were helping with the service. We're renegotiating because our lawn mowing company, Fiesel, for the past 2 years that we've been here, gave us a notice that they're going out of this mowing for small entity business. So we had to renegotiate and find another company that's gonna mow our lawn. It's unfortunate we're going to renegotiate any of the contracts downward. It's really hard in that economy and that inflation. But we're gonna be paying a little more for mowing, and we paid a little more for plowing. I don't think garbage pickup, are we paying more for garbage pickup yet? No.
No, I think
Yeah.
our contract we signed for that's been since 2019 when we moved into this building.
So
So it's probably 3 years.
Our phone system is through the county, but we pay our own bill. It's kind of a separate, but through the company that service the county. So that's kind of pre-negotiated at the county level
Yeah.
for all the county offices.
Well, I mean, in the chaos of COVID, we lost track of like paying attention to invoices and looking at things and contract dates and,
Yep.
you know, renewal options, et cetera. It's, once you start digging into it again, I mean, it's kind of a,
Yeah.
maybe even a 1-year process and a little longer on a couple of them, but just about everybody wants to keep you.
Yep.
But then there's other people that want to do business with you.
Absolutely.
There's usually some sort of, I didn't know who was the
Yeah,
date
well,
watcher.
I'll sign on the dotted lines for all of them, but again, all leadership helped me with their contracts. I'll give you an example with the Help Me Grow and, you know, the incentives that the state's been sending money for. You know, that the leader for that section, you know, Alexa for Help Me Grow, in the case of Help Me Grow, she will negotiate where we're gonna get those different incentives bought from, how we're gonna deliver them, and will provide support at with the fiscal team. I think the best thing that the board's done a couple years ago is having our fiscal be in a team more than just one person.
Yeah.
You know,
Help Me Grow looks like she goes to Walmart quite a bit.
well, we're renegotiating and we're changing that a little bit, and maybe she will talk about it while she's on her report, because it will be more cost effective. It will be more efficient use of our staff time, so on and so forth, instead of going shopping. We were thinking, well, we've done that for the last 2 years because we were thinking this is a temporary thing, but it looks like it's continuing for a little bit. So we need more permanent solution for purchasing those items and bringing them here for the home visitors to take them to their families. So I'm sure Alexa will shed more light on moving forward. How we
Well, I
can-
commend you for all the things you guys do and trying to keep everything balanced and, you know.
Yeah.
The cash isn't negative, you know.
It's like, you know, managing a $4 million budget is like having a small business, and, you know, for that end. And I think having the expertise of a lot of our staff and the learning curve of a lot of our staff. I mean, we do send our fiscal staff to a lot of trainings. We do work closely with the auditor's office. And in my report, I was going to talk about all the desk audits we've been having because it's required, and because of all the federal money that flew into our budget for the last 2 years. So it looks like if you talk to Chelsea and Lindsay, because they're close to it. I'm watching at a higher level. They'll tell you they've been audited every other week here, which is true by so many agencies. But this is good. I think this is kind of extra set of eyes that's going to look at what we're doing, how we're accounting for our time, especially those COVID grants. It was massive amount of documentation that we had to submit with the help of Chad as well, because he got to do with a lot of finances of those grants. It's a lot of documentation of each and every minute we spend out of those funds, because those are federal funds that were funneled through the state. So a lot of people don't realize how much scrutiny we get because we're using public money, whether it's grants or whether it's coming locally. I appreciate that question. I appreciate
So the breakout on if it goes to this budget, that budget, or the other hourly it's not by minutes, it's by quarters, or?
It's by hours. By hours, and it can go to quarter hours all the way to full hours that you have to account for your time, what activities you were doing around, so we can charge you back to the grant, including myself too. So so imagine the 2 years, every and each phone calls, every and each coordination we've done, every and each meetings we've had, every and each collaboratives, every and each discussions we've had, whether with the board or community partners, have to be logged in those. And that was a massive desk audit that the Ohio Department of Health was doing on actually 4 grants all at once, right? Is that correct? So imagine, and that's one person. Imagine having 30 individuals back in 2020, a lot of our staff were assigned to do COVID related activities, and they were paid out of those grants as well. So
Thanks for keeping it all straight and coming out the other side.
We're trying, and
with
we-
better systems that, will serve you well in the future.
absolutely, and we appreciate the oversight from the board here, and you guys looking closely at what we submit to you every month, and coming back with good questions.
All right, any other comments or questions on,
Okay, I think now we'll move into, okay. Now we're gonna move into Chad's, I can get that up. I had them all queued so we don't take the time to open them, but, that's okay, we've had that, hiccup and we'll work through it.
I'll stand up here, that way you guys can stay in your seats and turn around. So just a couple of things I wanted to add. So we did receive, with MRC, Medical Reserve Corps, we've been pretty busy over the last 2 years, and we've been able to receive some funding over those last 2 years. We received a $5,000 and a $10,000 grant to continue promoting the MRC, but then also we had the opportunity to apply for what's called a RISE Award. It's a national level award, and it stands for Respond, Innovate, Sustain, and Equip, which basically you're trying to continue promoting your MRC and move it forward. And they had levels of anywhere $25,000, $50,000, and $75,000 awards, and we applied for the $50,000 award and we received it. So what we're going to be doing with that is we're going to be, again, supplying our Medical Reserve Corps volunteers with certain supplies, medical equipment. We're going to purchase a couple of AEDs. We're actually going to be purchasing some other different things, just to, again, to equip the volunteers, maybe some portable generators to be able to use out in the field, like the Honda type, which are quiet and be used for IT equipment, things like that. So it was really a surprise, pleasant surprise to receive that. I think there were over 200 units in the country that had applied, and from my understanding, they all were funded, and there was a second round of funding for those that weren't able to apply this last time.
Chad, excuse me, you want to mention some, since you're talking about the volunteers, the MRC volunteers, about the honorable mention that we're gonna get?
That was next to my list.
Oh.
Yeah. So we actually.
See, I was so excited about it.
I know, that's good. It was on my list. So the other thing is, we had applied also through NACCHO, which is the National Association of City and County Health Officials. They're the ones that provided this funding, but they also gave us the opportunity as MRC coordinators and co-coordinators to recognize volunteers as well as our units. And I know that we had submitted for several of our volunteers. Actually, one of them was Karen, for her coordination and assistance in trying to continue to promote our public response with Medical Reserve Corps. And so we also had provided a nomination for our unit, and we were recognized for honorable mention. And there were several levels for that, but they're going to be recognized on the 19th, which is this Tuesday, through a webinar. I sent out a link to all of the medical volunteers. If you'd like, I can share that link with Kareem, and he can share it out to the board. But it's at 2 o'clock, and it's going to be a nice national recognition for all the MRC units out there that responded. Which leads me into the preparedness summit that Hannah and myself attended, our epidemiologist attended last week in Atlanta. It's the first time they've held it in 2 years. This is my 4th time going, but it was really kind of a large COVID hot wash, if you will. Much of the discussion was around that. Much of it was around the Medical Reserve Corps volunteers and their response to the pandemic, as well as public health's role in pandemics and future responses. And we also talked about funding, and that was a big thing. That we always talk about here is with funding is always kind of peaks and valleys. It's never really a consistent thing, and that's something that they said that we really need to be vocal about at the local level, state level, to make sure that we're getting the support we need consistently. But we had a great opportunity to go there, have a good dialogue with other public health professionals, did meet some other people from Ohio, did meet somebody from Kansas who received another RISE award, and we shared information so that we can collaborate and share ideas on what we might use our funding for. Other than that, it was, like I said, it was a really great experience, and hopefully we'll be able to continue to do that in the future. I'll take any questions if you have any. Okay, thank you.
Thank you very much, sir.
Thank you, Chad. So let's queue up Shannon's.
I have to stand over there too. Good morning. So, as far as our Children with Medical Handicaps program, you probably saw in the financial report and some of our numbers, we are finally getting back to where we want to be and putting more emphasis on that program, where our public health nurse before was kind of brought to COVID and brought to helping with the clinics. So fortunately, we were able to have her go shadow one of the really good public health nurses in Van Wert County that's been doing that program for a while and has a lot of specialties in there. So she brought back all kinds of different ideas of what we can do to keep those families engaged, and even to the extent of kind of getting back out there to get brochures back into the hands of not just the providers, and hope. We don't have a lot of BCMH providers here in Findlay, and part of that's just because we don't have a large pediatric specialty. A lot of our kiddos go to Nationwide, or not so much here, go to Michigan, but they can still be a primary care provider, or dentist is a big thing we come across. But just getting those brochures out even to the schools and to the community so they're aware of the program, so that they do get referred, they can refer them to the right places where they can financially help them. So we're excited about that. School nursing, we're wrapping up, and then you saw in my written report that we were able to train 2 of our staff to be CPR trainers. So not necessarily just for school nursing, it will be a benefit that we can bring to the schools, but we're excited to bring that out on the mobile. We're excited to be able to start offering that once they're completely checked off. So they're not completely trained yet, but once they are, to be able to bring that to the community as well. Communicable diseases, not a whole lot more. We've been monitoring the hepatitis B, and we had 0 cases this month, so we're excited about that. Still starting, I'm sure Dr. Ratnasamy will mention, or he's seen that too in his office, that we're still seeing a kind of an increase in the chlamydia and gonorrhea from where we were to now. So just getting education out there and providing resources for those individuals. Keep going, Kareem. Oh, the HIV test. So a long time ago, we used to partner with, I forget who it was, but anyways, it was very large scale for HIV tests. It's now regionalized throughout the state. So we don't hold the grant locally. We're not able to do that. You have to just have a disease intervention specialist, which Allen County has, and they're wonderful to work with. So they provide the test to us. They help train us. We have several staff on through Gary and Jamie to some of our nurses that are trained. So it's been just a challenge of kind of getting that off. As you can imagine, we want to be able to see that done a few times before we take that individual to do that. So in previous months, I've reported that Equitas has been coming every Wednesday. So our staff has been able to shadow with them and get comfortable. So this is the first month we've had 3 tests that our staff have been able to perform. So now that they're starting to get comfortable, we'll start to make sure we get that advertised out to the community, that we have those tests available. And then kind of that segues me into what we're hoping, and Kareem had mentioned, looking at the fall schedule for the mobile and that nurse practitioner, like what are some opportunities in the winter months that we can get to. So hoping really this fall we can get off the ground an STI clinic and that sort of thing. We do qualify this year. It's a reproductive grant through the Ohio Department of Health. This year's grant, I think, gave Hancock, we would have been eligible for, I believe it's $45,000. So that's kind of probably the area we'll be looking at that'll help offset that and help us get that off the ground. And hopefully we can have it internally and out in the mobile clinic as well. So and then clinic, if you look at our monthly numbers, it's the first month that we have had our numbers where we really want them to be, looking at previous years. So I think hopefully we're getting back to where we need to be. And like Kareem said, a lot of that's seasonal. So we've sent out letters, and a lot of it, like I said, I think it's gonna take education and getting people back to being comfortable getting those vaccines.
So the postage is like already maxed out for the year, is that part of it, sending out those letters for things like that?
As far as the postage, some of that will come out of our Get Vaccinated grant. Lindsay can probably speak to more of
That's
that
question to
postage
fiscal.
part of it, because
Well,
I'll be
I
honest.
mean, it was,
I'm
we're
not
already,
your
we're
physical
already.
We,
person.
we will make sure those letters go out, whatever, I mean, even if we have to, like.
I understand, yeah, I mean, budgets need to be changed and there's reasons.
Yeah, but that's a good question, no.
I saw we were
that's-
over the
that's a good
top
question.
already.
Yep.
That all started in the January when we were doing contact tracing with all those letters that had to be sent out for follow-ups. So that's where we had already
Okay,
took the big hit.
The previous years, we usually kind of know how much is coming from each program, and we're able to
Yeah.
kind of budget accordingly and take from each grant what we need to, but like Lindsay said, yeah, COVID was, we didn't know what we were
Yep.
taking out of, so. Any questions for me? All right. You're back.
All right, let me, just give me a second to queue up your,
Good morning, everybody. While
Good morning.
Corinne's pulling up my cute little pictures, I'll go ahead and start. You all probably noticed we have a huge waiting list right now. So we've kind of seen that creep up in previous months, but it hit an all-time high of 15 families. So I'm not sure if there's a baby boom. I'm not sure if it's life getting back to normal and agencies opening back up and allowing clients in and really having time to do a face-to-face interview and find out needs. But 15 families is almost the total caseload for a new home visitor. So that's something we're definitely exploring. But we're running into a space crunch. Our program has just expanded so quickly. We're trying to figure out, you know, is our program at 115 families going to be sustainable? And where do we put another home visitor? So in the meantime, I am sending monthly mailings to all the families that are on the wait list, and I'm doing a personal call with them to see if there's any resources that we can get in place while they're on our wait list. They are also all invited to our monthly play group as well. And I don't know if this is coincidence, but we did get invited to an ODH webinar. It's going to be held Tuesday, and they're going to be offering expansion grants. So I'm hoping that maybe that will be an opportunity we can take advantage of that might help offset costs and kind of be an incentive for us to expand. Another thing that I wanted to mention about the waitlisted families and the families we're serving in general is I've never seen such diversity. We have 5 families that only speak Spanish. So we are spending lots of time working on helping with immigration status, getting resources in place, and we do have a translation app that we use through ODH that's really helpful when they don't speak English. So that's been an experience for all of us. We also did get a referral just earlier this week for a mom that uses American Sign Language. So as far as diversity goes, that's really great for us as we apply for some grants, and it's a good learning experience culturally and linguistically.
So you don't have anybody bilingual on your staff, right? What about ASL?
We'll use the translator for that as well. Julie had taken a few classes in that through college, so I think she knows a little bit. Same with Marissa and I, we both took some Spanish classes in college, but obviously we're not native speakers, and when you don't use those skills, they go away so quickly.
Are there any, and Chad may know better, but are there any grants for teaching people here within the building or someone to be?
So we do have an MOU. We had used it previously with a Vietnamese family that we had. There's an MOU where the University of Findlay will offer their students or some of their faculty, so we can have an in-person translator. But the app is really nice because now they actually offer Zoom translations, so we can even video chat with them.
Technology's great.
I know.
So,
when it works.
Exactly.
when it works. All
Exactly.
right. Well, we'll see.
So
Just
more
testing.
to come on that. We are getting back into the community a little bit. We partnered with New Life Assembly of God for our Parent Connection, which was centered around Easter. We held it last week. We had a great turnout. There were 21 families in total that attended. The Hancock Hotel let us borrow their Easter Bunny costume.
Is that Kareem?
Maybe next year.
Not that tall, Doc.
So they had a big open gym area that the kids just loved running around in. We were able to kind of section it off. So we did an area where we had pictures. We did an area where they could do a craft. We brought some playground balls and they just bounced those balls and ran. And then we ended with an Easter egg hunt. So it was really cute and our families are really, really, really thankful to be back into the community and engaging again. The mom group is continuing at Findlay Digital. Next month, we will wrap up the school year for those girls. We do have 5 that are going to be graduating, so I think we'll focus on maybe like a smaller span graduation party for those moms. It's been a really great partnership. That's one program where we really hope our numbers stay low. We do have 2 moms that will continue then with their schooling in the fall, and we'll look at doing a bigger kickoff event for maybe some newly enrolled moms at that point. No Wrong Door was very successful. I sat on the steering committee for that event for the first time, and we were really pleased that about 100 participants tuned in. So it was hybrid. You could join via Zoom or in person at the University of Findlay. So they restructured that a little bit differently. They had a panel that focused on alcohol use during the pandemic. It was really interesting. In the fall, they will look more at programming towards families and children. Annika is finishing up her internship with us. She will be graduating next month as well with her LSW. We have a couple more events that we will be partnering with to kind of finish up her project. On Tuesday, there's an event called Take Back the Night. It's focused on sexual assault and domestic violence, so we will have a table set up for that. And she also finished a grant request on our behalf to Marathon, focused on community experiences. So a couple things Kareem alluded to that we were able to purchase programmatically was a children's museum pass that allows our staff admission into the museum to meet families. It's a really great place for kids. A part of that Marathon grant would allow us to purchase tickets then for the families. So right now we can meet them there for visits, but the family's responsible. They get a discounted rate of $2 if they show their Medicaid or WIC card, but then that would allow us to purchase that $2 voucher for them. We also purchased a Sam's Club membership to help with ordering some of those diapers. So we'll be able to order online. We'll be able to do pickup orders that will maybe help us in making 10 trips to Walmart. We will see how that works. And then the last item was that we completed our desk audit. Ours wasn't so much financially. It's looking more at were assessments completed on time with families, and those type of things. That looks at if our goals were SMART goals, were they obtained, were consent signed for the program. So that was all submitted and they have 30 days then to review on their end. Any questions for me?
I have a couple questions.
Yeah.
For those first 15 families that are on the waiting list, what is that process? Do you have like a triage system where you're identifying serious problems?
Yes.
So that they don't slip through the cracks?
That's something we've kind of discussed at leadership. So right now we're targeting any families that already have a child. The prenatal moms we're letting stay on the wait list, and I'm just following up with them to see if there's any resources that we can put into place. Anybody with specific high needs. So we had a teen mom that was referred from the local high schooler. Obviously that takes priority. We had one mom that was living at the city mission, so that takes priority.
Okay.
So we do screen those.
Okay. And then my second question, looking at the diversity, the governor has put out a notice to kind of prepare for Ukrainian refugees. So have you heard anything about that, or do you think that's a possibility?
I think anything's a possibility. At this point, most of our families seem to be Spanish descent.
Okay.
There's a local factory that even pays for them to live in a hotel, so we've encountered that a lot. We've had several
Wow.
families. They say that they work for a factory that packages lettuce, so I'm not sure if we have like a Dole factory or something
I don't know.
This time of year, you wouldn't think there'd be much lettuce.
locally, but with retaining and hiring employees, it very well could be. So that's kind of been the trend.
In years past, we had a lot of migrants, come up for crops, and there was a migrant clinic, I believe. Is that still?
We would staff that.
Yeah, the health department, yeah.
Could very well be, and maybe we'll see more with spring and summer months coming up as well, but it's just been a lot.
That may be a potential service that we need to look at in the future.
And that's seasonal, like you mentioned,
Mhm.
probably, we have to adjust to it. And could be, one of the mobile, outreach that we do to those migrant workers in their camps. Because when I was serving with the state, the migrant camps, housing camps, they do get inspected by the state.
Mhm.
It's not the responsibility of the local board. So, so they do, if we can team up with the state where we provide those services to make sure this community is healthy, because this is gonna project on the whole community as well here, so.
How do we become aware of people who are coming into our community? Are we
Usually we.
notified by nonprofits?
Well, the state works with farmers, like big farmers who sponsor those individuals coming into our community to help with crops and everything else. And once we team up with the big farmers, they will need those housing units inspected each year by the state. So we can get that list from the state if we are to team up on a mobile outreach to those individuals.
That brings up a good point though, because a lot of times, especially with home visiting, when we see those situations, we see a lot of incidences of human trafficking with the women. So that's kind of another issue that goes hand in hand, and STI checks, Help Me Grow,
Mhm.
all could be bundled into
Or
those
even all of the
services.
nonprofits at the, what's it called, the city center. If they let us know that people are coming for services, that we could
Yeah.
collaborate with
Yeah,
them.
typically we would see that a lot in the Macomb area, but
Mhm.
these are all centralized in the city of Findlay, so it's just very interesting. More to come on that.
Different.
Yeah. Any other questions? Thank you.
Thank you. All right, Lindsay.
Proud to say this time we have a sanitarian coming aboard. Actually, we have offered a position to Andrew Lehman. He is currently a public health student at BGSU and will graduate the end of April here. So what we have done, this is kind of a different approach. So excited to see how this plays out, but because he's not going to be eligible to get his SIT card right off the bat because he's got to wait till his degree gets conferred and he gets his transcripts. So we have made the deal of hiring him as an environmental health technician for 90 days. I've had conversations with the state and the sanitarium board, and there's no reason why he shouldn't be able to get that SIT card in those 90 days. So once he does receive that SAT certification, then we'll go ahead and transfer him over into that position. So excited. I think Kareem will agree, when we did the interview with him, he kind of brought a light of hope to environmental health again. And Kareem actually had an opportunity to meet his family because he received an award up at BGSU.
And I was
a couple
at
weeks
that
ago.
event, that's correct, yep.
Yeah, so good gentleman, excited to bring him on board. I think he's gonna provide some new opportunities for us as well. Another opportunity that we have is Madeline Harrington will be joining us with the mosquito vector position. She is currently finishing up her freshman year at Allegheny College over in Pennsylvania, and she is studying environmental sciences. very interested in the lab part of things. So I think this will be able to give her a opportunity as well. She'll work a lot with primarily Ryan, but Kurt will oversee what they're getting into. Mentioning the mosquito program, we did receive the mosquito grant again from the Ohio EPA for $24,000. So that'll be coming in here the end of May. That'll actually be used then to pay Madeline's salary for the summer. Any questions?
Open away, thank you.
It's busy season for environmental now that the weather is breaking a little bit. But I do want to mention one thing about the hiring of being creative in hiring, and I think it was really a good move. We kind of improvised and said, okay, that person is fresh out of college, he's accomplished, he's a scholar. He will, he interviewed very well. And we figured, okay, how can we kind of entice him into coming? So we offered him the job of being a technician until he gets his certification from the state for 90 days. Why we chose 90 days? 90 days is our policy for probation. So it was the caveat was you will become a certified inspector within those 90 days. Then you will move up to be a sanitarian. So I think that was plausible to him, and he's a very, very good kid. Like Lindsay mentioned, I got to meet his parents while at that award event, and he saw me, and I told him, "Are you ready to start?" And he didn't even graduate yet, and then he said, "Of course I am." So he was so it's good. I'm hoping that we'll retain him here for a long time because what we've been through the last year and a half trying to find a sanitarian for that job. So I think we're excited, and hopefully we're looking forward to a good start here soon. All right, Craig.
All right. I know Kareem touched on it, and obviously we're conducting this meeting streaming, but just wanted to touch on that, kind of why we moved. We had the equipment here in this room, so that's kind of why we're testing this setup here. And it looks like, I was monitoring the meeting, it looks like there's 4 or 5 people from outside the agency that have tuned in to, looks like everything, sound quality, the mics actually might be a little too sensitive, so I might have to look at, because some of the rustling of the paper and stuff. But we'll make adjustments on there to see if we can improve that. So other than that, I think besides Cream's computer crashing, I think so far, knock on wood, everything's been going pretty good. I know I touched on kind of the security improvements. Just earlier this week, our security contractor, Bell Security, finished some of the install of the cameras. So we're kind of wrapping up that project. He does need to install some more hard drive space on our recorder to finish up that project. But the nice thing about the security system is Cream and I can, and anybody else who wants to, can log in from our phones and view the security system if there is an alarm or anything going on. And we have, like I said, a lot more coverage of like the parking lot areas and the entry points to the building now with some better quality cameras too. So that'll hopefully increase the security, and if we do have any alarms to figure out what's going on.
And you said drive, so was that not cloud-based storage, it's all in-house?
Yeah, we're looking at different ways to store at least some short-term in the cloud too.
Okay.
Yep. And I know I've talked before about the document management project. I know that's been an ongoing project. It's been a long project. Unfortunately, the company we're working with, some of their staff we were working with left, so kind of had to restart that project. But earlier this week, some individuals from the company came in and did kind of finish most of the setup on the project. So the next step in the next coming weeks, we'll be doing training with staff for our document management system to help us go a little more paperless. And once we have that in place, we can also look at some QI projects of improving processes by utilizing that document management system. So I think once we get that in place, it'll open up a whole world of opportunity to make our operations a lot more efficient. So we're looking forward to that. Also kind of QI project we're looking at, I think someone mentioned earlier about our car fleet and leasing. We just had a QI project nominated and we're looking at a way to more efficiently manage our fleet. Because we do have occasionally, some of our staff need vehicles to go to meetings and other things that pop up. So we're looking at a QI project to improve our way of how we handle those cars. our
GPS
fleet.
tracking,
Yeah.
Geotab or something like that.
Yeah, and to make sure if someone needs a car, that if nobody's using it, that it's available so they can take, so. Cause it is a long process to figure out if somebody needs the car. They have to go around and figure out if people are using the car for the day, so trying to make that a little more efficient, so.
And Geotab has not only tracking and safety scores per person per drive, that's what we use. But there's also some scheduling in there and maintenance software that have everything.
Yeah, I think we're gonna start with probably the scheduling part first and then look at safety and things like that as we go down the road, so. All right, that's all I have, unless you guys have any questions.
Thank you.
All right, that's, I will lead into my report to the board this month. You've heard most of the operational things from different leadership there. I want to talk about stuff they did not talk about yet, and we'll talk about COVID for a little bit. You might heard in the news that numbers are ticked up just a little bit at the state level. Same here, but nothing to be really concerned about. I think we were expecting to see the numbers go up a little bit because people are not in mask and you know, we're back kind of a normal kind of. The two really metrics that we are watching here for COVID is serious illness and hospitalization and death more than any you know, mild illness that's been connected to the Omicron and the variant that's dominant right now. We are, our cases went up to daily average of 3. We were at 1, you know, about a week ago. We don't have anybody in the hospital right now from Hancock County, but we got 3 hospitalized or admitted in the last 2 weeks here, which is about 6% increase. That we haven't had any, knocking on wood, and we want to keep it that way. So I think test positivity is about 2% or a little more this morning, but again, nothing to be really concerned about. Nationwide, I think the United States is doing really good as far as infections. If you see a lot of the areas and county levels here are either green, which is low, very low, or yellow. Ohio, the state of Ohio, the whole state of Ohio is in the green. So things are really promising there. That's our local dashboard that's going to be released here this morning, like we usually do once a week. And we are still at a CDC community level of low. Again, those 18 cases were reported the last couple days. And again, because maybe a lack or delay in reporting or something like that, that's causing those high numbers in one, you know, in a short period of time. But in all, we're still looking good, and we're hoping to keep it that way. Again, we're ready to deal with outbreaks or, again, slight increase in numbers. Would really the more the focus is going to be on high risk individuals in long-term setting or something like that, and more the focus is going to be for the seriously ill and hospitalized, and go from there. So I hope COVID is not going to be a disruption here moving forward, but we've seen what happened in Europe, and we're kind of watching and monitoring what's going on. It looks like we're doing good, and we're knocking on wood again that the United States will be spared of what happened overseas. A quick legislative update for all of you. The State Assembly is on recess for 2 weeks, so there's not a lot of updates. One thing we've talked about before is House Bill 463. This is the House bill proposing elimination of the DAC. A little movement on that bill, that it was referred to the House State and Local Government Committee. And that committee had hearings on it last week. Things are moving slow. There's a lot of input that needed to be done at that level, and our state association is watching that closely. So I'm thinking there will not be a lot of movement between now and our next board meeting, so I can get you more updates. A lot of moving part, and it looks like from the hearing I watched last week on that, it was hearing for proponents of that bill. It was more, they had 2 individuals testifying, and really it looks like this is really a local problem that's being dealt with by the legislator at the state level. And I think the Representative Stevens, who introduced that bill, kind of realizes that part. And he's working through to make sure it's done properly, if at all. So we'll keep you updated. A couple new bills of interest, or maybe not at this point. They were introduced. Is Senate Bill 47, introduced by Representative Brenner and Peterson. That got to do with overtime. It's basically, it prohibits an employee from joining as a party plaintiff in a lawsuit that is brought for violation for Ohio's overtime law, unless that employee got the permission of their supervisor. This won't affect us at all. It won't affect a lot of places because they have policies in place. Our policy is to get the supervisor's permission before you work overtime. So I think it doesn't affect us. It affects places where they don't have that policy. And employees the last 2 years, they did work overtime, but without explicit or written permission. I think that's the key, written permission of their supervisors. So I don't think we're gonna be watching that bill too long. I don't think it will have any effects on public health or our agency. House Bill 563, that's introduced as well last month by Representative Arthur and Ferguson, and the proposals to amend ORC to limit local regulations for short-term rental properties like Airbnb and such. So that's, again, an emerging need for regulations, and it looks like the locals all over the state are kind of improvising on that. And what the state legislators then trying to do is kind of organize that and make it standard across the state. So that's for my legislative update. I have a couple quick updates here. Yes, I'm sorry.
Back to House Bill 463, eliminating the DAC.
Mm-hmm.
Would that not trigger other legislative amendments as to combined health districts?
Yeah, and here locally, and when I said it, it looks like it was a local problem in one of the counties, because here we have a totally different experience. When we combined 6-7 years ago, it was the understanding, and it was kind of that delicate balance that was stricken back there, and a lot of you were part of that too, where the county and the city will share the responsibility towards the health district. And where the cost saving to the city and the county were kind of embodied in that combination or that merger. It's going to be delicate on who's going to kind of control now, how we do business if it goes to the county commissioners alone, because that's what this bill is proposing, that they do away with the DAC, go to county commissioners. Problem is, the DAC, the townships don't want anything to do with us because they want to get out of, paying their fair share. But what they don't, I think there's a lot of details that are being missed here, because regardless, you have to have public health services, whether you're a township, whether you're a village or a city. That's by law. You have to put towards that, and that's where those little appropriations we get every year from the city and the county to go toward our budget. Again, it's in our report, and you guys are aware of that. But for our public watching, we do get close to $500,000 in a budget of 4 million plus. So it's a little, but we want that investment from all of our township and the cities in our public health services to keep it going and keep it supported. So in that respect, I'm afraid if this goes through and it becomes law, this might disturb that balance that our elected official made back in 2015 when they said, okay, we're gonna merge, we're gonna save money, and that's how we're gonna run our public health services. So it might have, that's why I mentioned it first, and I want to keep you guys, updated on how things are going with that bill. It's moving slowly, and again, a lot of input from other health districts, a lot of input from county commissioners, a lot of input from DAC members and township trustees, village mayors across the state going into that bill to just make sure it's done right.
Do we need to provide any input?
At this point, I would say our input is going to be kind of providing, the facts or how businesses, because what's getting lost is a lot of the members of the DAC, the mayor is on the DAC, the chair of the county commissioner is on the DAC. So the DAC is made up of all elected officials. And I think that's being lost, and that's why I think that suggestion was to move it to county commissioners, because they're, they oversee other boards as well. So why the DAC here? It's kind of, at this point, I would say that we're gonna wait and see what comes out of it, because again, it's gonna affect us all, and we don't want to be biased, being a bias towards one way or another. At this point, we more want to provide the facts and how we're doing things, and do more education to our elected officials. Here locally, that's been done 5 years ago when we combined, but at the state level, there's a lot of work to be done. Either we had, on calls and stuff, we had, I've had one county saying that their DAC did not achieve quorum in 10 years. So those things needs to be addressed, but instead of addressing them at the local level, they're trying to do some at the state level. And that's exactly what's going on with this. Any other questions?
We're broadcasting. I don't know if everybody knows what DAC is.
DAC is it's a district advisory council. Here in our county is made up of 29 individuals representing all the townships, the city of Findlay, and all the villages, the village mayors as well. Our DAC is pretty active. I mean, the last meeting we had was beginning of March. We always have people enthused and coming and engaged. They are kind of their own entity, and they govern themselves, so they're not part of the health department. A lot of people think they are part of the health department, and that's what people who were kind of going for that, proponents for that bill thought that the DAC is part of the health department. This is a independent governing entity, all elected public officials on there, and they're the one who elect board members. So they meet once a year, and they do have oversight of our budget. So at their annual meeting, we do present our budget to them, and we present any vacancies to the board to them as well. But again, they're the governing entity for the board.
Thank you.
Any other questions? Okay. We can start the 4.0, where we talk about all the new business here. Just give you updates on this different projects or initiatives we've been working on. Really quick. So if we do this, trying to kind of reopen all the stuff I had opened for that meeting. strategic plan. Okay, personnel, we did not have any hiring or separation in during the month of March. I think this is really good. We were able, since the beginning of the year, we haven't had any separations. And I think this is really credit to the leadership who are really working on retention, especially in this economy, and especially a lot of the staff we have, they're tired from COVID and tired from the continuous response that we've had for 2 years. So we're trying to balance as much as we can and keep them happy and engaged and doing a good job. And it's a challenge. I know Dr. Ratnasamy can talk a little bit about staffing at the hospital and how everybody's having a hard time with the staffing right now. So I'm knocking on wood again that we are almost fully staffed. When we get that sanitarian on board, we will be fully staffed, and we didn't lose any employee since the beginning of the year. So that's part of the performance I want to talk about, because retention was one of the initiative on it, and we did pretty good on that as well. Now, let's talk about performance management a little bit, or kind of bring you all back to our strategic plan. I do want to apologize. This first quarter, I do not have a printed written report. We do have a written report. It's just handwritten for now, because we were having a hard time with getting the file that Paul helped us send to us, so we can fill them in and kind of bring up a nice report. Like I mentioned when I was doing the financials, a lot of the measures and indicators on our improvement on our dashboard, they're kind of not quarterly. It's more of a 6 months and a year. So we'll be able to kind of do better report for all of you next month. But today I want to just go over our different initiatives and give you a quick update on what's going on with those and how we are moving with them. So I'm gonna start with again, following the strategic planning session that you all were part of late last year in December. And I think that's how we came up with that plan for 2022. We did improve a little bit of our mission just to make it a little more, we cleaned up some language there, our vision, and same as our values. Kind of we streamlined a little bit, so they will be more apt to be shared with the public, and the public will clearly understand what's the intention of the board moving forward with that strategy. So we did talk about strategic priorities, which those are going to feed into the dashboard. Financial vision was number 1, where we keep a healthy carryover, which we did last year. Part of it is keeping that ratio of revenues to expense on check. So on the financial vision, we've done pretty good, and that will be green on the dashboard when we bring it back, next quarter. Hopefully the second quarter will do the same. So we are on track with our financial vision. Our customer strategy, this is kind of a yearly initiative or yearly priority where we do survey our customers and clients and see what kind of feedback they have on how we can improve services. The beginning of this quarter was kind of rocky for that particular strategy or priority, because we were in the middle of a surge in January, and I think we were lucky enough. We got caught up a little bit in February and March to kind of improve on those. Customer strategy is continuous training of our employees to, on customer service, and I think we've done pretty good on that. We will have, we're trying to kind of figure out, and I'm working with Paul on that, on how to capture feedback, because what we've noticed that a lot of our clients don't have the time to go through lengthy surveys, or sometimes they, so we're trying to make it some easy, like where on their phones, they'll be able to give us quick feedback. Were you happy? Were you not happy? And if you were not happy, how can we improve on your experience coming in here, getting a service, whether it's a clinic, whether it's environmental, whether it's any other service we have. So this is work in progress as well. Process improvement. Craig talked a little bit about process improvement and a couple projects we're working on. And Chad started working on our annual report for FAB, for the accreditation board. Those projects are going to be part of that as well. It's in his written report. People investment, I talked a little bit about it as I was reporting on retention. We want to invest in our individuals. Like I said, we don't have a product we do here. All we have is our people. And I think since the merger here, or the combination, we've been really honing on that idea of we want to invest in our people, want to get them the proper training, give them the proper tools, try to help them balance life and work as much as possible, with the focus on, again, customer service and client service first, and service to our community. People investment, another indicator we have is how can we get them involved at the state level, at the national level, how we can leverage. I don't know if Chad mentioned that or not. Him and Hannah traveling to Atlanta for a week was fully paid for by grants. So we're still trying to leverage a lot of the injury prevention grants, pay for individuals to travel, get training, get networked. I think the more we talk to people in our field, the more we learn and bring back, and the more we enhance our service to our citizens. We always, in public health, we're always seeking best practice, and best practice, it's best done not via Zoom only. It's best done when you talk to people and shake their hands and let them talk to you about their experiences, what works for them in their communities, and bring them back here to the table and see how we can project all that success that everybody else is having to our community and make it more streamlined and efficient. So we're working on people investment big time. Again, we're sending people to conferences, we're sending them to trainings. We are working on professional development here. I think when we talk about some of the initiatives, we're going to talk about some of the activities as well. Now, again, I'm telling you, I couldn't get the electronic version, so most of the leaders of those initiatives gave me their reports in writing, so I have to enter everything once I get that program to work, and it will be part of your report coming up. But I want to start talking about the different initiatives here, part of updating the board on our strategy. I think the first initiative was, and that was the largest one that we and you came up at those meetings for the strategic planning, was to deploy the mobile health clinic. I think the expectation for the clinic for the last 2 years, and the expectation of the funders and community partners, was to focus on COVID vaccines. And the mobile did for the past 2 years. Now, moving beyond COVID, we want to go back to the original plan of what that mobile clinic, how it's going to serve the population here all across the county. So some of the tasks and the project leaders on that particular initiative is myself, and Shannon's helping me with that too as well. Our team is me, Shannon. We have Elisa, the CMA, that's been assigned to the clinic. We have our health educator, Jessica, and we have financial, Chelsea's helping us as well, kind of make sure we move the money as needed. A couple of the things we did in this first quarter towards that goal or that initiative, that working on policies and procedures, and we had 2 or 3 of them ready to be finalized. We are working on recruiting the team and the mobile team, and certifying and certifications. Elisa went back and got her CMA certification. We talked in length about the nurse practitioner and the certification we're going to get in there, and how our recruiting plan is to post that position on Monday, start interviewing as applicants are coming in, and we had an end date or a target date for the recruitment to be concluded and have hopefully candidate accepting our offer by May 13th. Again, not to start because a lot of individuals who are in those positions, they will need a lot more time to give to their employers, but at least conclude the recruiting process by 5/13. So we did purchase a lot of equipment and supplies, from blood glucose monitoring to A1Cs to cartridges. Lisa and Shannon work on a lot of that with Chelsea to make sure we move the money and order all the proper equipments. So the mobile is very well equipped now for wellness checks, for everything else. Like I said, we were using it for COVID vaccine the last couple of years. Now we're gonna have to make sure we're well equipped for the next phase. I touched on it a little bit about the schedule. So I think part of the tasks that we have put together to accomplish would be to come up with a spring and summer schedule for the mobile. That's we're gonna start on that immediately. We're not gonna wait until the practitioner's on board because we don't want to miss on any events that's coming up. I think Alyssa put together with Jessica, our health educator, they put together a list of events that potentially the mobile can be at. And we will start regular meetings next week as a team to make sure we come up with a schedule for early spring and summer for when that nurse practitioner comes on board. We will have some for them to start on already. The fall and the winter schedule for the mobile, we're starting to. We put a target to start on that in early August, to have it ready by early fall, and again, to include different aspects in it, whether it will be the mobile crew that's holding a clinic here or helping with the clinic 1 or 2 days, depending on the ability to go out with that mobile in the winter months. So we're trying to maximize, the gift of the mobile that the community and various agencies gave, and to make a difference in our the lives of our citizens. So that's on that initiative. I think strategic initiative number 2 was to improve communication. And back then we didn't have Cheryl on board, so we hired a communication specialist, and the leader on that initiative is Chad. We hired a communication specialist. We put the annual report together, reaching out to the community. Social media, website updates, and I want to give shout out to Cheryl because she's done a marvelous job during Public Health Week. I hope you guys were following us on social media. A lot of good information, a lot of good videos. I think this is gonna, again, reaching out in that respect to the public is gonna help our agency serve better. So I think we strongly believe on that. And those are a few initiatives they work on. Coming up in the second quarter, we're gonna finish up reviewing and revising or updating our communication policy, our communication plan, work on the website. So there's a lot coming in the pipeline here, but it was a good start for the first quarter on that initiative. The third initiative was going paperless, and I think Craig talked about that a little bit, and the leaders on that project is Craig and Lindsay, because I think we decided the first programs that will need to go paperless is environmental. They're taking away a lot of space for paper files. So we thought we'll clear up some of that space by helping them go paperless first. Craig talked about the quality improvement team, had a initial meeting. A lot of the initiatives on that were dependent on equipment and the installation of equipment. I think Craig touched on our contractor coming in and installing the equipments, the scanning equipments, and how they're gonna go into the files and everything else. So we can, the team is gonna meet again and set a date where we will start on the actual project. So that's the progress on that initiative. The last initiative we have on there is the keep staff and customers safe. And the leader on that initiative project was Alexa. Alexa was being held by Shannon, Chad, and Craig. And a few tasks that were accomplished in that first quarter. Alexa put in writing for me as well. I'll read them for you before again we enter into that. I think one of the goals were to for all staff to complete ALICE training, was active shooter training. I think we did that last month, end of March. That went very well. It was very informative. All staff participated in that. We had the sheriff's office come in and helping us with the actual training. They did the actual training. This is completed. It was completed on the 25th of March. And I think a lot of recommendations that came out of that meeting will feed into the rest of their activities on that project. The installation of panic buttons in the receptions area, the installation or working on installation on a doorbell for deliveries in the back, because we've noticed something the last 2 years or 3 years we've been here, that a lot of deliveries are coming through the front door. And a lot of times that will be disruptive to our clients who are in the lobby, and it's disruptive to our frontline staff where they have to go and look for who ordered that stuff so they can receive it and sign for it. So I think the installation of a delivery door, the assignment for delivery door being the garage door, and putting a kind of doorbell on there. If a delivery driver comes and ring the bell, any of us, it doesn't have to be the frontline staff, any of us who are back here available to answer that call so we can receive the goods. The outdoor camera system's been updated. We added more cameras. We did talk about some security in the parking lots and some of the blind spots our existing cameras had. So I think yesterday they completed, that was completed yesterday. And we have a good camera system around the building now to make sure the building is secure. Or if we get an alarm, which sometimes we do because of after hours, an employee forgot that one of their colleagues still working in their office and they go and arm the building before they leave. And that the minute that person comes out of their office, my phone and Craig's phone will start ringing off the hook. So what we will do now, even on the phone, we can watch what's going on. And a lot of times, if Craig's not available or I'm not available, one of us will watch the videos and say, oh well, that was one of the Help Me Grow visitors. She was she had a late visit and she was leaving the building later, and that's why nobody kind of noticed she's still in the building, and that's why it was armed. So we were able to kind of dispel a lot of those and not have police respond or anything of those alarms because of that system. So it's going to be proven to improve security to our building as well. Chad, part of the team as well, helping Alexa. They did work on a lot of the signage that we see. We put on the side doors that those doors are for employees only, because in a few instances we had clients trying to come to the building through those doors. And another thing they're working on that came out of that ALICE training or the active shooter training that we had last month was how to kind of block those windows. Because one of the things that the trainer or the deputy who was training us was big on is the minute you learn of something going on in the building, the notification is first, but second, what do you do? If you're in your office, you have that window open, usually, but I mean, you have to be prepared for anything. But their experience been that the shooter will go to where people are, where they see light, where they will be able to see. Chad, Alexa, and their team are working on a kind of system where we can, on a really short notice, they can, there will be some kind of a blocking of those windows, so nobody will see what's inside that particular room. Because locking the door is one of the #1 things we do in an active shooter situation, heaven forbid. But anyhow, I think it's part of the preparedness that we have to go through, a meeting place. So if we are to exit the building, where do we meet? Stuff like that. So they're working on all those logistics and what came out of it too. Alexa's working for her home visiting staff to get some training in self-defense, because those individuals, I mean, to a lesser extent for restaurant inspectors, sometimes we are in a situation, especially in a private home, you are in a situation where you don't know what you're getting into, not from the client themselves or the mom or the family they're working with, but it could be a family member or something that's that we don't know about, but they're having issues with their family. So I think that self-defense class is going to help the safety of our home visitors going into the homes and spending a long time there, because the visits are supposed to be, assessment visits, and that takes a long time. It's not like a quick visit. It cannot be done at the door. You have to go in and sit with them and kind of help them through it. So they're working on that, and they started working on it shortly after we had that training, and they don't have a date yet for that training, but we're trying actively to get them some help that way. So that will conclude our quick update on our strategy. So I think we've done pretty good on the first quarter, and we're gonna work on more structured report for all of you. This is a new format we're using with Paul and his group, and I think it's a good streamlined format because it's easy. It's a lot of fill in the blanks. Each and every leader kind of will be able to kind of say what their team's working on, and we'll be able to all feed it to you guys at least once a quarter to see how the whole agency is performing. I know it was a little long, but I think once a quarter, we appreciate you kind of listening and giving us feedback as well, and how we can improve.
I really think FAB is going to like this kind of a report also. What do you think?
Yeah, if this is a lot more simplified than what we started with a few years back, where we had all those metrics and those metrics and a small print coming to all of you. I think that dashboard idea of just hitting, the high level, and if there's issues, we'll dig deeper and we'll go into what's under the hood.
Will you also give us the red, yellow, and green dashboard indicators?
Yes.
Will you give us that?
Yeah.
So we can kind of see?
Absolutely.
That's the way the hospital does theirs.
Yeah, we're gonna try to adapt it to be part of that dashboard, so it won't be too cumbersome for you. Like I said, at your level of governance, you just want to make sure everything is working fine.
Oversight.
That's correct. But there's a lot of details that goes into that dashboard, and I think we have as leadership to worry about it and kind of make sure we are performing to the expectation of the board and the expectations of the people we serve. All right. If you guys don't have any questions, I talked a little bit about the community health assessment. That's almost ready. We are in the final stages of finalizing. The committee of partners did meet a couple weeks ago to look at the rough draft. They had a lot of good feedback back to our consultant working on that report. And they're gonna do all those changes by the end of next week. I'm gonna give them to them next week to get all the feedback done. Then they will invite us to another meeting where it will be a second draft, and hopefully it will be close to the final. Once that report is done and we're ready to publish it, we want to make sure we make a little event around it where we publish it pretty well and the public is aware of the health situations. Dr. Ratnasamy talked about obesity today, but there's a whole lot more information in that that could be useful to anything the public is engaged in and touches so many aspects of their lives. So we're looking forward for that. I think the whole community is looking forward to the response. It's not going to be, especially in the time of COVID. So it will be kind of interesting to see how this COVID affected the different things, the alcohol use and the drug use, the obesity issue. So it will be interesting to see how that affected us in the last 2 years. So just revisiting, I think we talked about it in the beginning, but just to rehash, today we're trying this format to see what's going to work best. Again, in future meetings, we might be moving to the bigger room and try and to adapt some of the equipments we have in here. I think what we heard from the board and community members last board meeting was that we want to do it efficiently. We don't want to spend a lot of money on it. At the same time, try to provide that service to our constituents and our citizens to be able to kind of watch how you guys conduct business every month. So I think, again, this when we designed this building, this room was designed to be the board room. And that's why it's wired with microphones and stuff to be that way. Trying to adapt that technology to the bigger room might be a little challenging. It might cost, money here and there. But if we feel the need to move to the bigger room again, we will kind of improvise as much as we can. We're trying to look into some grants or some help with financing some, cameras or something like that to be able to capture that bigger room with a wider angle, more sensitive microphones for that big of a room, so on and so forth. So I think the vision and the directions we're getting from the board is to do this with minimal cost, again, because none of that cost was provided for into the operating budget we approved back in December. So we're gonna try to work with the means we have. Again, I'm sure we'll be hearing from the engaged citizens who are interested in listening to our board meetings on how that went and how we can improve on it. So stay tuned. This is a trial today. It might change next month. It might change in a couple months, but we'll keep assessing and readjusting and to kind of make sure to get as close as possible to a good feed to the public.
So we're broadcasting, but it's also being recorded.
That is correct.
Is there a way for us to visit the recording and like within the next couple weeks, all of us watch it for 30 minutes, 20 minutes?
Absolutely.
I mean, we need to make sure we're.
Yeah.
You know, hear everybody.
We'll be able to share. Yeah, we'll be able to share. And to make sure that, again, the recording probably is going to be part of the feedback process. You're right.
Yeah.
So the recording will be made available as well.
So the recording, when it's made available, is that posted to Facebook? Is
Well,
there a
I think
comment?
we're going to try what works
Still need
best.
to work out those details.
Okay.
Yeah, this was kind
I
of the
mean, this
trial
is
for
like
it. And we can
step
kind of
one
move
of,
on.
24 levels probably, right?
Yeah.
Yeah, but I think it's good progress, and I think the resolve, and again, per the board directions and per the request of the public as well, that the expectation is not for us to spend tons of money on it, especially that it's not been appropriated in our budget for this year, but to kind of try to leverage what we already have. And the starting point, like you said, Brian, is here because we have technology here. It's not the best, but we want to see how this is going to work and how we can project it to a bigger room.
That'll just take time.
Yep. That's the, unless any other board member have new business?
I do. It's that time of year for the executive director's evaluation and the medical director's evaluation. So we will have the packets at the May meeting, and we'll give you a couple weeks to finish those, and then we'll report back at the June meeting.
That time.
We will need an executive session at that time.
Okay. In June or in May?
June.
June, okay. All right, so continuing education, it says we do not have any.
Yeah, I think we went over the 2 hours already. And I think last meetings, CEUs were really helpful. I think even the community and the community members who were at that meeting and listening were very engaged with Gary's presentation. And I think we want to keep bringing staff to the board meeting, just not to make it long, but to kind of make it a little more, not educational, but let awareness at the community level of the different programs and services we have. So I'm hoping that the next board meeting we'll be able to bring in some other staff from other areas of the health department to kind of give you guys an insight to what's going on there.
Any other information? Next meeting, Friday, May 20th, 2022 at 7:30.
Yep, same time, same place. Like I said, the format might change, but we'll get you notified a little bit. And if you allow me, President, I'd love to just mention one thing that I failed to mention at the beginning as I was doing introductions. We're all wearing blue ribbons, this week and this whole month for Child Abuse Awareness and Prevention Month. And we appreciate the board members who are putting those ribbons on, and please talk about the issue to anybody who will ask you why you're wearing a blue ribbon today. So that's what we've been doing. That's what our staff been doing here all week. And this is an important subject, and to public health and our families and to the whole community as well.
All right, do we have a motion to adjourn?
So moved.
And a second?
Second.
All in favor?
Aye.
We're good. I just want to thank you all for a good meeting and wish you happy Easter weekend here. Enjoy the cold weather. Yes. All right. Thank you all. And thank you to our visitors as well.
Mr. Egg.